How do we decide who gets a COVID vaccine first? Sandy Tubeuf and her colleagues tried asking the public what they think. Sandy, welcome.
Hi.
Now, in all this excitement about getting a vaccine or vaccines that work, it's easy to forget that we just can't immediately vaccinate people overnight, can we? What are the constraints that we work under here?
Here we're working on the constraint that we will find some vaccines. There won't be only one vaccine, and then maybe the production won't be as fast as we would like. So not everybody that could benefit from a vaccine will be able to get one.
So clearly we have to prioritize, and one obvious way to prioritize is to ask the experts about who should get it first. Is there a consensus? What would someone like the WHO say about who should be vaccinated first?
So I think at the moment the consensus is really to say who are the people that actually are very fragile, people that actually are living the worst consequences from any COVID infections. So we're looking into people with underlying morbidity that is making it harder for them to win the battle against COVID. Then you will have as well the essential workers, so people that actually make the society work, and how actually those ones should be vaccinated because it helps the society as a whole. And then of course we have as well other risky groups, so older people that actually could be vaccinated first. And then there's been as well quite a lot of elements from the fact that some areas are more disadvantaged, even socially, and so maybe will face harder contagion rates, and so should be vaccinated.
That's still quite complicated, and it's still probably more people than we can vaccinate at first, isn't it? So is there a simple rule for who gets it first, who gets it second that we can invoke, or is there inevitably some value judgment comes in here?
So there are value judgment for sure. So who do we think actually should have it first because they can benefit the most? And then there is another layer on this, which is more related actually to the efficacy of the vaccines themselves. So you probably have heard that most of those vaccines that are being developed are not exactly the same. And so some might be more effective with certain populations, some might be more effective with others. So there will be a large number of dimensions to take into account. So it's not only about who can benefit the most, can get it straight away, but it's taking into account the fact that some vaccine might be more adapted to some other people. And then, as I said, there is this aspect of not having enough vaccine in the first place.
Well, one way to work out who gets the priority is to ask people what they think. That's exactly what you did in Belgium, isn't it? Who did you ask for this?
So we decided to go for the general population. And so we actually had a survey that was done so that we had a representative sample in the population. And so when I say representative, we try to be representative of age, sex, education, and regions in Belgium. And so we had 2,000 people participating to our study.
When you're asking these 2,000 people, it's quite a nuanced question. Are you sure that they understood which groups were which and what you were asking about this?
I hope they did. We really spent a lot of time preparing the questionnaire, testing it, so we piloted it. But even before that, we actually ran it, in our families, friends, older, people, younger one, trying to see if everybody was understanding the questionnaire. And we wanted on one hand, to give as much information as possible, but without pushing people towards certain answers. And so it's really tricky when it's about, preferences, when it's about groups, because here it was about priority groups. On one hand, you wanted to give enough information on the groups, but you didn't want to say, straight away who they were. So for example, if you think about essential workers, obviously, everybody will think about, healthcare workers. But essential workers could also be the police, the firemen, everyone that actually is really useful and continued working even during confinement. And so in the end, we were saying actually people that have been essential to the economy during the confinement without, really citing them directly. In the questionnaire. And so then we were asking people, their preferences after giving them as much information as possible.
Now, in the first stage of this, as I understand, you came up with 8 strategies. And some of those strategies were sort of like single groups and others were slightly different. And you asked people to rank these strategies from 1 to 8.
Yeah.
Which of these strategies was most supported?
So it was actually 3 strategies that came up as being ranked either first, second, or third, mainly by like 2 groups of 20 or 30%. So 1/3 of the population really liked one, another third liked another one, and maybe another third liked a third one. So we had 3 that actually were, I think, quite, let's say, popular in the beginning. And so it was vaccinating the essential workers, vaccinating the people that were more at risk of COVID, which are 2 different groups here: people with underlying poor health, and then people who are over 60-year-old.
So straight away, it's slightly complicated, isn't it? Because I don't think you've got from here a 1 that's incredibly popular, then 2, then 3, then through to 8. It's that's not how it's worked.
No, they were completely overlapping, in terms of position. So it really felt like the population was, hesitating between which one would be really first, and then which one could be second, and which one could be third. So yeah, we were really asking people rank from the one that is the most desirable as the first priority group to the very last one. And so we had this, quite interestingly, because if we look at the bottom, it was the other way around, where we had as well 3 that people were all agreeing to push, away.
Well, I mean, it's good that there are ones that people really don't like, so we can forget about those. Mm-hmm. But on the other hand, how do we get from this to an idea of a strategy that might get some consensus that people would want to go to? How do you research that?
So the method we were using here is this kind of best worst, exercise where you ask people to rank. And so then we went in a second step where we provided slightly more information to the individuals responding to our survey. And so the 8 strategies that we had in mind initially, 5 of them were concerning subgroups of the population. And so there were those 3 that I said were first. Then we also had a group of people, for example, who would be virus spreaders in the population. So people that are more likely to spread the virus. And we didn't, again, targeted one group in particular, but we're saying we're talking here about people that actually meet a lot of people during the daily life, or people that are living, in an environment where actually they interact with a lot of people. So, and then the 5th group was actually people that would be costly to the society because actually they're out of work because they got COVID. So then what we did in a second step, we started putting figures on that. And so we told them someone that is a big virus spreader is someone that on average will contaminate 10 persons. And someone that is a very small virus spreader is someone that on average will only contaminate 1 other person. And then for the cost to the society, we're saying the same. We said, we're talking here about someone that would cost €0 if he's out of work because of COVID, someone that would cost €100, or someone that would cost €1,000. And then we did a second step, with this extra information.
And again, once you do that, do you get to a simple consensus?
So no, we didn't get a simple consensus. So in that step, it was slightly more complicated as an exercise. And I think maybe some of the respondents really felt like we were asking them to make ethical choices that were tricky. And so we were presenting them with 2 profiles of individuals. We were talking about a person A and a person B. And so we were defining those individuals according to the 5 same characteristics, but giving different levels on those characteristics. And so we asked them, after looking at those 2 profiles, which one of the 2 they would vaccinate. And then here, people actually were choosing according to the levels, whether it was someone that was having an essential profession, having a chronic disease, and being older, but on the other hand, not costing that much, not likely to spread too much the virus, compared to someone described roughly similarly, but on different levels. And so what came out is that actually we had similarly, let's say 3 groups that actually could be vaccinated first. But while we had those three groups, it was really separated into, let's say, two clusters of the population. And so roughly half of the population was saying that first they would vaccinate the virus spreaders. And then second, they would go for the essential professions. And the second cluster was also putting second the essential professions, but was putting first the people with actually vulnerable medical health, so people that are more at risk of COVID because of their health status. And so while they both agreed on who was second, the two groups were disagreeing on who should be first. And so again, you don't really, identify one single group that should get the vaccine first, but you can see that the population, has different opinions.
One thing that they were united on are the strategies that they didn't really seem to like. You introduced the idea that people could get it through a lottery, or that it was first come, first served, or people could buy the vaccine and it went to the highest bidder. It looks from your research that did not get widespread support.
No, that didn't get at all support. And I think, I really think that people understood what this kind of strategy would mean, but they also understood that maybe that wouldn't be the best strategy for the society as a whole. And I really think that the lottery, for example, is an interesting one, because this is the most egalitarian one. It's almost saying, let's say that we know we don't have enough, so we will just pick randomly who can get it first. And I think the society, as a whole really realized that maybe, even if it's egalitarian in a way that we all equal chances to get it, on the other hand, it might not serve actually the purpose of the society, like what could be the best for all of us. And when we see that actually a large part of the population wants to vaccinate first the virus spreaders, it means as well that maybe they don't see themselves as virus spreaders, but they also think that if we tackle first those that can contaminate a large number, then actually maybe we could help with reducing contagion as a whole. So it's quite interesting to see that actually the population was keen to identify groups first.
Given that there wasn't really a complete consensus, and that there are some really quite large differences between the strategies that the public would have, so should governments even really be consulting the public about which order to give the vaccine to people, or should they just stick to their own experts, or, just whatever their prior belief is?
Yeah, I think there is a debate here, but I really think that actually if you want a successful vaccination campaign, you need to do something that actually the population will be agreeing with, because we know that actually, wearing the mask does work if everybody does it. We know that actually being confined works if people respect confinement. So I also think that actually, vaccination campaign will work if people are willing, to participate to those campaigns, or things that actually they are fair campaigns. I also think that the other important element here is, while the WHO, the European Commission, all those experts have identified the groups that actually should be prioritized, few of them have been really ranking it. And so in a way, they've all identified groups that matters, but they've not really ranked them from the one that should really be first, the one that should be second, and the one that would be third. And so they're not really already taking into account the fact that even if you have identified 5 groups that matter, you will not be able to vaccinate all the 5 of them straight away. So you won't avoid, doing a ranking at some point.
Well, these are big decisions that are going to be made over the next few weeks, aren't they? So, Sandy, thank you for helping us by doing the research, and thanks for coming to talk about it today.
Thanks a lot for inviting me.
The paper's called Who Should Get It First? Public Preferences for Distributing a COVID-19 Vaccine, and the authors are Jeroen Luyten, Sandy Tubeuf, and Roselinde Kessels. It's in COVID Economics 57. Well, thanks for watching. You'll find lots more new research on the impact of COVID-19 in COVID Economics, free and, as ever, open access at CEPR.org.